My name is Michelle Bayevsky, and this is a video abstract for Respecting Autonomy, a call for truth in commercial advertising for planned oocyte cryopreservation. Imagine the following scenario. You are a reproductive endocrinologist, and a 25-year-old woman walks into your office and asks about egg freezing. She's conflicted. She's seen a bunch of ads on Facebook and Instagram. She doesn't want to miss out on the chance to have a family, but she also doesn't want to worry about finding a partner and having kids in the next 5 or 10 years. She's heard that if she's considering freezing, it's better to freeze earlier so her eggs will be as young as possible. She doesn't have a lot of savings, but she thinks that egg freezing could be a good investment in her future. I'm sure many of you readers have had a conversation like this before. We all want to support our patients as they make personal healthcare decisions, and to ensure that women have choice and freedom to plan their reproductive lives. Yet, it can be challenging to respond to aggressive and at times misleading marketing forces. Planned oocyte cryopreservation, or planned OC, may be right for some young women, but patients must be presented with truthful, evidence-based information in order to make their own autonomous decisions. In this inkling, we describe typical advertising claims made by commercial egg freezing companies, focusing on statements aimed at convincing young women to pursue planned OC. Then we review the medical evidence behind those claims. We find that evidence does not support certain key marketing claims, specifically that planned OC can be used as an insurance policy against age-related infertility, that freezing younger is necessarily superior, that egg freezing stops the biological clock, and that anti-Mullerian hormone, or AMH, is a marker of future fertility in young, healthy women. After presenting these data, we consider possible legal and ethical responses to misleading ads, including actions by the Federal Trade Commission, or FTC, the American Society for Reproductive Medicine, and individual physicians. We argue that misleading advertisements distort patients' understanding of the risks versus benefits of planned OC, thus unethically undermining patient autonomy. We suggest that the FTC consider investigating whether some ads meet their standard for misleading advertising. We propose that ASRM comment on deceptive ads and work to promote access to accurate information regarding the risks and benefits of planned OC. Finally, we suggest that physicians can be advocates for more equitable employment practices that may reduce pressure on young women to delay childbearing. If women felt less pressured to spend their most fertile years focused exclusively on their careers, planned OC would be much less enticing. Moreover, measures including affordable childcare, flexible work hours, and longer maternity leave would benefit all women, not only those with the means to pursue planned OC. Reproductive endocrinologists and OBGYNs more broadly bear witness to the pressures experienced by young women to delay childbearing and can be powerful allies in efforts to improve labor practices for all women.